Welcome back. The report card is out for maternal mental health, and the Policy Center for Maternal Mental Health gave Texas a C. The Lone Star State is one of 25 states that got this grade. Dr. Sarah Orek is a reproductive psychiatrist and CEO of Mediva Health. She joins us to break down this report. Thank you so much for joining us.
Absolutely. Thank you for having me. Postpartum depression and anxiety is really common. I think it's about 1 in 3 or 1 in 5 women. The reports are 1 in 7 or 8, but these are all self-reports. And often we don't even ask these questions of a lot of our patients. This maternal mental health state report is really exciting because it has told us for the last couple of years some of the trends, challenges, and disparities that we see in pregnant and postpartum individuals in their mental health care across the U.S. And the good news is that Texas has moved over the last couple of years from an F to a C because it's gained some intensive outpatient programs and it provided some enhanced Medicaid reimbursement. But that's still, has a long ways to go to an A. And frankly, no state in the United States has an A yet.
And as you just said, Texas received a C. C is barely passing. Where is there room for growth? Where would you like to see us improve?
Yeah, I think there has to be more access to outpatient care. This is where Mediva Health is actually operating in Texas for this reason, because especially people in rural areas have very little access to really high quality maternal mental health. Additionally, SB 8, which is that Texas abortion ban, new study came out that's impacting women, even if they're not seeking an abortion, and really impacts, I think, pregnant patients' fears about what may happen to them because it's so restrictive and not an evidence-based ban.
The report gives Texas only 2 out of 5 stars for parental support. How do leave policy and childcare pressures affect maternal mental health?
Oh, they're tremendous. We see this with studies where countries give federal paid leave for both parents. We see just improvements in postpartum depression and anxiety. And of course, that's why I think even California has a slightly better rating than Texas because of those state policies around leave. We know that return to work is one of those really high stressors that can actually worsen postpartum depression and anxiety.
Definitely. It's a huge conversation around that. Overall, what is the biggest takeaway for you when you looked at this report?
I thought, hey, this is some movement in the right direction, but we still have to, and I saw that there's more screening, of course, that's happening. That means that your obstetrical provider is saying, hey, how are you feeling during this pregnancy or the postpartum? But more than just asking the questions, we have to connect people to care that actually is effective and evidence-based. And also, I think, work on the stigma. Because you get mental health care does not mean that you are a bad mother or not a good enough mother. It just means that you need support during this time. And I think the destigmatization of getting mental health care is actually a huge key for people to feel motivated to get care.
It definitely is. Dr. Orek, thank you so much for your time.
Thank you for having me.